I want to make sure that everyone knows up front that this will be among the shortest keynote addresses you've ever heard. So I hope that's helpful with the agenda in terms of your time. But I do appreciate this opportunity in the limited time that we have to be able to talk about some of the realities of the legislative process, the policymaking process, as the title of my remarks indicates. First, let me say a word about the work that all of you are doing and the work that's being done here in Washington to work in partnership with you and to be responsive to the challenges faced by so many families and communities throughout the Commonwealth of Pennsylvania and throughout the country, and indeed across the world. First and foremost, what is particularly challenging for us, but also I think summons us to do what we've tried to do on rare diseases, is the basic understanding that I have and you have in a much more profound way, either by way of expertise or experience, but also in some cases in a personal way, is that these kinds of diseases or conditions imprison people. So that child, that family, is imprisoned by a disease, and they feel like they're the only person in that prison. They don't often hear about or experience that sense that they're part of a larger group of people, and that there can therefore be a commensurate response in terms of policy making. So that sense that they are in their own prison is particularly, I think, disturbing and particularly frustrating for people that face these diseases. What we're trying to do is figure out ways in the policy-making area to unlock that prison for that person, for that family. And it's not easy in the environment of Washington. You know, you don't have to be an expert on Congress or an expert on policy-making to know that Washington is a place where there's more dysfunction than there is coming together. There's more divisions than there are areas of common ground. And even on issues that pertain to health care, that pertain to disease, the response that Congress should have to the fight against the disease, to medical breakthroughs, and all of that. Even in those areas, there are too many divisions. So I come here today to be honest about that, but also to indicate to you that none of us should have a sense of despair about that. It only means we have to fight harder. We've got to be more creative, more determined, more focused on trying to find a result. And I really believe, contrary to what you might think, that you play a direct role in that. There are limitations to what individual members of Congress can do between and among themselves. I'll talk about that for a moment, but you have a direct role to play. As I mentioned, one of the frustrations is with rare diseases and the therapeutics to treat those diseases is the small number of people that are affected. You can't aggregate within a community or within a state or even within a nation sometimes enough power or enough impact to make the kind of progress you would hope to make. But I think that what's happened over the last couple of years is encouraging. I don't mean to distort or to exaggerate that, but it's been encouraging. And I think from the point of view of individual members of the United States Senate and House, in my case in the Senate, I've got to ask myself, and you might ask yourselves, well, what can you do alone? Or what can a group of you do? Well, number one is you have opportunities to convene people, to get people in the same room, to get legislators, to get experts, to get researchers, to get medical professionals and others into the same room to talk about and to strategize. And that's something that a number of us have done over the last couple of years. We also have to be very focused on how do you incentivize the creation of strategies that will lead to solutions. And that incentive, the incentives that we're trying to provide, of course, is focused on leading to the development of new products to treat those rare diseases. Now, this is an area where we've had some measure of success. Just last year, Congress passed, and this is a long name, but we even have an acronym for it, like we do everything, the Food and Drug Administration Safety and Innovation Act, known as the User Fee Bill, where entities pay a user fee as part of the funding. It's called FUDASIA, which sounds really elegant, but it's really just an acronym. But that piece of legislation included a proposal that I had, the so-called Creating Hope Act, which is a bipartisan piece of legislation. And by passage of the larger bill, which included the elements of the Creating Hope Act, we've brought about the opportunity now for a voucher program that we hope will incentivize more countries, more companies, to develop new products to treat rare pediatric diseases. And that was, as I mentioned, bipartisan. Now, you might think that getting bipartisan support, Democrats and Republicans on the same bill for the same purpose and working together to pass legislation like that should be more customary, more routine. But as I mentioned before, it is not. And when I was looking at the co-sponsors at the time, it's a pretty broad cross-section. You had Senator Blumenthal from Connecticut, a Democrat, Senator Roy Blunt from Missouri, a Republican, Senator Scott Brown from Massachusetts, a Republican, Senator Sherrod Brown from Ohio, a Democrat, Senator Mike Crapo, a Republican from Idaho, Senator Al Franken, Democrat of Minnesota, Senator Kirsten Gillibrand, Democrat of New York, Senator John Isakson, Republican of Georgia, Senator Frank Lautenberg, Democrat of New Jersey, Senator Chuck Schumer, Democrat of New York, and finally Senator David Vitter, Republican of Louisiana. You cannot find a more diverse group of United States senators landing in one place than those groups of individuals. You don't have to research it. Take my word for it. It's the one thing I'm sure about. I can't give you pronouncements about research. I can't give you other pronouncements that you could contest. That is a pretty broad cross-section of legislators. And I mention them individually and by way of party and geography to tell you that because of your work, because of the efforts of all kinds of researchers and companies across the country, and I know in Pennsylvania, whether it's Pfizer or Shire, and some folks in Pennsylvania represented here today, that you have created your own momentum. You have created your own dynamism that will lead to the incentives that we need by way of federal legislation. But we still have a long way to go, because I know what we did last year is but a step, is perhaps a good start, but a long way to go. So you should also take inspiration from that, but also understand that this isn't just something where you can, when you write a letter or make some phone calls, that somehow that's going to be enough. You have to stay engaged. Members of Congress, despite what you might think when you visit them in their office, you might think that this is one of hundreds of meetings they have and you're not going to have an impact. You've already demonstrated that you've had an impact, and we need you to stay engaged. But by way of building a national network of supporters with people in virtually every state in the union, you've been able to contact legislators, you've been able to make your case, and we need you to keep doing that. Because individual members of the House and the Senate can't do this without the push from you, without the inspiration that the research provides, without the momentum that you've created already. For researchers and those of you from in the room today from the industry, it's also important to stay engaged not only with Congress, but with federal regulators. And I know you understand this and you know this, but I'm going to keep repeating it. Particularly the FDA itself, because there is an old expression about the squeaky wheel. That's true of Congress, it's true of regulators, and I think it's true more broadly than that. We've got to make sure that we stay engaged and stay focused, that even as we made progress with the voucher program, even as we make progress in other ways that are measurable, we've got to do all we can to keep and sustain that momentum. And I know that the World Orphan Drug Congress will serve as a catalyst for both new ideas and for new collaboration between and among all of us. So I encourage you to share your ideas and your policy proposals with members of Congress on a regular basis, and to keep pushing, as I must do, not only those members and their staffs and the Congress as a whole, but also to keep pushing our regulators to focus on sometimes an individual disease and sometimes the story of an individual child or family as a way to personify the challenges that are faced by that individual. And to the extent that we can continue to work together, and I know we can continue to unlock the prison by prison, really disease by disease, that child, that family, and sometimes a very small group of individual families are confronted with every day. You've already made progress, and we need you to continue to stay engaged. Thank you, and God bless you.